Mr. Sampson. I'm Bailey. I'm going to be your nurse today, and I'm just going to be checking you out, see what's going on with you. Do a head to toe assessment. I'm going to wash my hands and close the door for privacy. Before I start, I'm going to do my QSIN. So, can you tell me your name and date of birth? Right, can I see your wristband? Okay, got the correct name on the staff whiteboard. You are not on oxygen, no feeding tubes, no abdominal tubes, no chest tubes. You don't have a trach. You don't have an IV or saline lock. And you got 2 side rails, the bed's in low position, your call light is in reach, obstacles are out of the way. You got your assistive devices on your table, water and pitcher cup, urinals at your bedside, your toilet and commode is over here and it's empty, and your trash bag is attached. Alright, so now I'm going to do my head to toe assessment. Okay. So can you tell me your birth date and where you are, and tell me the month or day if you can. Alright. I'm going to look at your face symmetry. Everything looks good. Okay. I'm going to go ahead and I'm going to listen to your heart. Or your heart and your lung sounds. Okay, listen to the back side. Okay, I'm gonna listen to lift your left arm up for me. And lift your right arm for me. Alright, and then I'll listen to that heart sound. Alright. Are you having any kind of pain or tenderness in your upper extremities today? Anything that I need to know about? Alright, I'm going to check your pulse, take your vitals. I'm going to check your pulses bilaterally. I'm going to take the blood pressure, watch the respirations. Make sure I look at the pulse ox, take the temperature. I'm going to have you pull away from me. Okay, push towards me. Wiggle your fingers. Okay, I'm going to check your cap refill. Okay, good. And then I check the warmth and color of the patient's skin. I'm going to check your skin turgor. Okay, and are you having any problems any problems in your stomach or anything? Are you passing gas? Are you, do you know when your last bowel movement was? Okay, I'm going to go ahead and lift up your shirt. I'm going to take a look at your stomach. Okay, and I'm going to go ahead and listen around in there. I'm going to listen to all 4 of the quadrants. Okay, I think sounds good. Now I'm going to feel around for any tenderness or distension, any firmness. Everything feels good. Are you having any problems going to the bathroom or any burning or anything when you pee, or have you noticed any abnormal discharge? Okay, I'm going to check out your legs and see if any edema. Okay, and then I'm going to have you push towards me with your feet, pull away from me, wiggle your toes, check your cap refill, then I'll check pedal pulses. Okay, alrighty. So it took your vital signs. Your temperature was at 98.7. Your pulse was at 74. Respirations were at 14th. Your blood pressure was 124 over 72, and your pulse ox was at 70% or 97% on room air. So, you said you came in today with a little bit of, you had right knee pain, and it's been there for about 3 days. Okay. And said you're a little had an unsteady gait and that you're limping a little bit in that leg. And I noticed then on that right knee too, it's swollen, and it was reddened and warm and tender. I also noticed when I took your pulses, you had swollen nodule on your wrist, and then you had 2 swollen nodules on the proximal knuckles on your right hand, and a swollen nodule over your elbow that was shiny and had 2 white dots on it. Okay, and some of the things before you get discharged today, just for a little education for you, is that some of your risk factors and triggers for if it happens again, so you know, is that it happens more in males that are over 40, if you have family history, if you're obese, if you increase your meat and seafood, excessive alcohol, hypertension, renal insufficiency, diuretics, aspirin, if you've had an organ transplant, trauma, illness, dieting, increase in your purine diet, joint stress, and illness. And I also found out with your labs, you did have an increase in your uric acid level, and your x-ray was showing some crystal deposits around those joints that are swollen and hurt. Now, some of the things that I would have done, that I would have made sure to look for prior to for regular signs and symptoms of gout is tophi, uric acid, your urine calculi, severe pain and redness, swelling at the joints, discomfort, or limited range of motion. And I would do the assessments that I would want to target since the patient has symptoms of gout is if for pain, stiffness, assess their range of motion, if they have tophi, if they're itching at those swollen areas, joint edema, erythema, and check out their diet since the uric acid levels could be increased with gout, and that would be because they are eating a lot of purine, high purine diet. All right. All right, so now I'm reporting off to the nurse. I'm going to tell the nurse, this is Mr. Sampson. He came in, he's 62 years old, came in, was saying he had knee pain for the past 3 days. His gait was unsteady. He was limping and guarding his right leg. He says he has hepatitis C and HIV. So then I looked a little farther. His right knee is swollen, red, and warmed and tender. He says they swell up like that all the time. He also noticed swollen nodules on the left wrist, 2 swollen nodules on proximal knuckles on the right hand. They ordered x-rays, basic lab tests, ESR and CRP. Then we also noticed when taking the lab test that he had a swollen nodule over his left elbow that was shiny and had 2 white spots. So then they also ordered blood uric acid test. The x-rays came back showing crystal deposits at the swollen joints. His uric acid levels were elevated. He says he had history of gout, and he drinks wine daily. And then after 2 days of giving anti-inflammatory and physical therapy, he has his swelling decreased. He's able to walk without pain and will be discharged today. I did educate him because he didn't seem to understand what could trigger his gout. So I educated him on that, and also his vitals from earlier too, where his temperature was at 98.7, pulse was at 74, respirations were at 14, blood pressure at 124/72, and his pulse ox was at 97% room air.